How to use your twisthaler. First, sit or stand upright. Holding your twisthaler upright with one hand on the gray or pink color base, with the other hand, twist the white cap counterclockwise until the cap is removed. Now, one dose of your medication is loaded and the dose counter seen on the base has decreased by 1. Next, turn your head sideways away from your twisthaler and slowly breathe out. Holding your twisthaler horizontally, place your teeth over the mouthpiece and your lips tightly around it, being careful there are no gaps, and also check not to cover the holes on the side of the twisthaler. With your head tilted back slightly, inhale through your mouth quickly and forcefully, breathing deep into your lungs until they are completely full. Hold your breath for 10 seconds, or if unable, as long as you possibly can. Remove your twisthaler from your mouth and exhale slowly away from your medicine. Replace the white cap back on your twisthaler, turning clockwise until it clicks. If you need a second dose, repeat the steps again. When the medication is empty, after 45 doses, the cap will read 0 and lock.